February is Heart Health Month, and to raise awareness about the severity of heart disease, Dr. Jeffrey Teurtenberg with Stanford Healthcare joins us now. Thanks for coming on the show.
Thanks for having me.
All right, so let's talk about heart failure. How common is this?
Unfortunately, it's all too common. There's about 6 million people in the United States with heart failure. And if it was a city, it would be the second biggest city in the U.S., so behind New York, ahead of Los Angeles. There's about 500,000 new cases of heart failure every year, and every year about 300,000 people die of heart failure. If you look at the economic costs of heart failure, they're also very high, somewhere between maybe $25 or $30 billion a year spent on heart failure, both taking care of people with heart failure and things like missed days of work and loss of productivity.
Okay, so it's a very common thing, but what does it mean to actually have heart failure?
So it's sort of a clinical syndrome. Basically, it means that there's pressures that build up in the heart, and that backs up into the lungs. That can make you short of breath. That pressure can build up into the belly and make you feel full, or make you feel like your belly's swelling. It can back up into the legs and make you have swelling in your legs. It can also cause non-specific symptoms like fatigue or just tiredness.
I remember getting a call from a family member saying, hey, grandma's in heart failure, and I thought, that means she's dead. And they said, no, here's what's going on. So it's good that you're specific about that, but there are different kinds of heart failure.
Yeah, there's two big kinds of heart failure when people go into the doctor and they're diagnosed with heart failure. And it's based upon sort of how well their heart squeezes. And we measure that by something called ejection fraction. And basically that's the percentage of blood that enters the heart that is then squeezed out when the heart contracts. And it's not 100%. 100% is not normal. Somewhere between 55 and 60% is normal. So you can imagine if someone's heart isn't squeezing very well and they have a low ejection fraction, that the pressures could build up behind the heart and cause you to be short of breath. For people who have a normal heart function, or what we call heart failure with a preserved ejection fraction, the heart has to be able to relax to accept the blood, and just like for people who have weak heart muscles, the pressure can build up if the heart doesn't relax well enough and can make you short of breath, just like if you had a weak heart muscle.
Okay, so shortness of breath, that's definitely a symptom.
A big symptom of heart failure.
Okay, so let's talk about the risk factors.
Sure. A lot of the risk factors are sort of common risk factors that we see that people go to their primary care doctor for, things like high blood pressure, high cholesterol, obesity, diabetes, those sorts of things.
Okay, so that's something that you definitely need to look at. And when you get diagnosed with, let's say, high blood pressure, what do you do?
So the best thing is to, again, go to your doctor, get your blood pressure measured, follow their treatment plan, because a lot of these things, it's not just that you have high blood pressure for a short period of time, but over the long period of time. And particularly when you have combinations of things like both high blood pressure and diabetes, that can increase your risk for something like heart failure over the years.
So you talked about the two different kinds of heart failure. Are they treated differently?
They're treated differently. The heart failure with the preserved ejection fraction, for the people who have sort of stiff hearts, unfortunately there's not a lot of great medical therapies for those patients. It's mostly managing their fluid and then managing the things like the high blood pressure and diabetes that are risk factors for them getting it. For patients who have a weak heart muscle, there's actually a lot of good medical therapy out there, and it's been out there for a long time, and recently there's even been the development of a couple new therapies. So it's a very exciting area of heart failure, but we're still stuck with the people who have a weak heart or stiff heart muscle. We're still looking for good therapies for them.
So is it only medicine that can help?
So it's mostly medicine. For some patients, they have also valve disease as well, and it's important to treat that. We have better treatment for valve disease. Sometimes it requires open heart surgery, but more and more it requires less invasive things through catheters, sort of tubes placed through the arteries of the body. They can allow you to repair valves or replace valves without needing an open heart surgery. Managing heart rhythms, sometimes pacemakers or pacing strategies. People with weak heart muscles, sometimes you can pace both sides of the heart at the same time. And then lastly, if patients are getting really, really sick, there's things like transplant or mechanical heart support that patients can live with as an alternative to transplantation.
Okay, if somebody is watching right now and saying, well, I think there might be something wrong, but I don't know.
It's best to just go get checked up. A lot of these things, again, the risk factors are very easy to tell. You don't need to go to a cardiologist necessarily to be able to diagnose them. And even a cardiologist doesn't even necessarily need to manage some of those things, but it's important to get a hold of those risk factors and treat them early and aggressively so it doesn't develop into heart failure in the long run.
All right, great information. Dr. Teurtenberg, thank you so much.
Thank you so much for having me. I appreciate it.
All right, and remember, Stanford Healthcare, it joins us every Monday, so tune in next week for a new segment. Still ahead on CBS and Bay Area, one lucky Warriors fan gets a surprise